Now we will see in details about internal hemorrhoids, how they are developed, what is its etiology and all. So internal hemorrhoids, it also includes, when we use the term internal hemorrhoids, it also includes intero-external hemorrhoids. So collectively intero-external hemorrhoids you can in general call as internal hemorrhoids. Dilatation of internal venous plexus. Internal hemorrhoids is caused by dilatation of internal venous plexus within enlarged and displaced anal cushion. When the anus cushion is enlarged and is displaced or has moved downwards, in which the internal veins have undergone dilatation, it leads to internal hemorrhoids. Now another cause is communication between internal and external venous plexuses. Communication between internal and external venous plexuses causes engorgement of external venous plexuses when the internal veins have undergone dilatation and tortuosity. Because there is free communication between internal and external venous plexuses, when the internal veins will undergo dilatation and tortuosity, it is very likely that external veins will also go dilatation and tortuosity. That's why internal veins will be presented as external hemorrhoids. So that's why we are collectively causing it as internal hemorrhoid. Intero-external hemorrhoids have been included in internal hemorrhoids. Now I'll see etiology. First etiological factor is hereditary. That might be some congenital anomalies. There is congenital weakness of the venous walls. If the venous walls are weak right from the birth of the baby. Another cause is abnormally large arterial supply, and this is common in legs and rectum at the same time. So there will be concurrent varicosity. So at the same time the patient will have rectal dilatation and tortuosity of the rectal vein, as well as dilatation and tortuosity of the lower limb veins. So both varicosity of the lower limb and varicosity of the rectal vein, that is hemorrhoids, will be present at the same time. So hereditary because of congenital weakness of the venous wall and abnormally large arterial blood supply. Second is morphological. Weight of the column of blood without wall. Now you know portal veins are having no valves, just like other venous system. The portal venous system is having characteristic feature that it is having no non-return valves. So because of lack of the valve, the portal vein, tributaries of the portal vein has to carry the blood against the gravity. That's why it continuously causes the weight of the column of blood on the lower part of the vein, particularly rectal veins. And because of this high venous pressure in the lower rectum, it is more prone for the dilatation and tortuosity. That is the morphological feature because of absence of valve. Third is anatomical. Now the radicals of superior rectal vein are unsupported in loose submucous connective tissue. Means all the veins, just like the rest of the gastrointestinal tract, all the veins, they are carrying the blood from rectum. They have to pass through the four layers: mucosa, submucosa, muscularis mucosa and serosa. So when they are passing through the muscularis mucosa, they are loose, where they can easily undergo dilatation and tortuosity because of lack of resistance. And when these pass through the muscle layer, deeper to the submucous layer will be muscle layer. When these veins, rectal veins, will pass through the muscle layer, the constriction of the muscle during defecation, when the person will try to strain, will try to pass the feces, what will happen? There will be contraction of these muscles present in the muscle layer of the rectum, and that will cause pressure. So it will mechanically, because of contraction of the muscles, it will mechanically compress the muscles, will compress the tributaries while passing through the muscular layer, and because of which the pressure will be increased on the part of the vein that is passing through the submucous layer. Where there is no resistance, it will undergo dilatation and protrude into the mucosa. And superior rectal veins are having no wall, just I told you, because they are part of portal system, and that's why there will be increased pressure in the submucous part where the veins will dilate easily. And fourth cause is exciting, straining during constipation. In case of habitual constipation, the patient is suffering from constipation for a long period, will cause dilatation and tortuosity, or overpurgation. In case of profuse repeated loose motions, watery diarrhea, the person can have hemorrhoids because of lack of tone and descent of the anal cushions towards the anal sphincter. So descent and swelling of the anal cushion occurs in this case. So this is about the etiology of hemorrhoids.